lateral spinothalmic tract. It carries all the types of pain, temperature, itch, and tickle sensation. Pathway of pain receptors are the free nerve endings. The first order neurons, they are carried from the receptors to the spinal cord by mainly A delta fibers, which carries fast vein fibers, and here the neurotransmitter released is glutamate. Whereas C slow pain fibers, the neurotransmitter released here is substance P. On entering the spinal cord, the pain signal take two pathways to the brain through neospinothalamic tract, which is for the fast pain, and paleospinothalamic tract, which is for the slow pain. The neospinothalamic tract, the A delta fibers, they terminate mainly in the lamina 1 of the dorsal horn cells, whereas in paleospinothalamic tract, C fibers, which are the fibers carrying sensation, slow pain sensation, they terminate on the lamina 2 and 3, which forms a substantia gelatinosa. The second order neurons arise at the level of spinal cord. Most of the axons of second order neuron cross in anterior white commissure obliquely to the opposite side of the same segment. They ascend in the lateral spinothalamic tract. The fibers from neospinothalamic tract end in the ventroposterior nucleus of the thalamus, and fibers from paleospinothalamic tract end in the interlaminar ventrolateral nuclei of the thalamus. On their way to the thalamus, these fibers send collaterals to reticular formation, periaqueductal gray, and tectum. Paleospinothalamic fibers give off much more collaterals than the neospinothalamic tract. Only 1/10 to 1/4 of the fibers pass through the thalamus. Axons from the sacral and lumbar segments of the body are pushed laterally by axons crossing midline at successive higher levels. Therefore, the fibers are represented as cervical to sacral segment from medial to lateral in spinal cord. A lesion in cervical region situated close but outside the spinal cord, for example in tumor, will cause loss of pain sensation in the sacral or lumbar segment as they are most superficial, but the sensation of the cervical region persists. The third order neurons in thalamus, the third order neuron starts and ends in the sensory cortex. This is diagram showing the pain pathways, the paleospinothalamic tract and the neospinothalamic tract. Both the tracts, the fibers, the first order neuron fibers, they cross the dorsal root ganglion and they cross at the same spinal segment to the opposite spinal cord in the anterior commissure. Then they are going to, the second order neuron, they are going to ascend up in the spinal cord in the spinal lemniscus. They're going to reach to the thalamus, whereas the neospinothalamic tract, which the fibers which are mainly of A delta afferent fibers, they are going to reach to the specific part in the thalamus, that is ventroposterior nucleus. So then third order neurons, they're going to reach to the sensory cortex. Whereas the fibers of paleospinothalamic tract, they are mainly of C fibers. They ascend into the spinal tract and they end into the interlaminar nucleus of the thalamus, and then from they diffusely go to the they form thalamocortical radiation, then they go to the sensory cortex. So this is diagram shows the arrangement of the cervical and thoracic fibers. They are going to occupy in the medial part in the spinal cord, whereas lumbar and sacral, they are going to occupy the lateral part in the